timeline of 3 months. Within 3 to 4 months, we enable you so well that you are able to give the exam, and also not only give the exam, but also pass the examination. Passing the examination is something which is very, very important. And more than 6,000 people have been certified after attending our training. And this number is ever increasing. And we have been doing this for last almost 15 years. So these are the things, these are the topics which we are going to cover. And if time permits, I'll show you some projects from the hospitals also, which a CPHQ professional would normally do. And about the organization, we have been there since 2006 and trained lots of Lean Six Sigma professionals in healthcare. Lots of healthcare quality related tools, techniques, and training have been conducted almost around the world. And I take pride in telling that I conducted the first ever Lean and Six Sigma training for healthcare organization. And this was incidentally for a hospital, if you can see that. Around the world, we have conducted the training programs, multiple hospitals, China, Saudi Arabia, UAE, India, US, Europe. National Healthcare Service, NHS, similar to what you have MOH in most of the Middle East countries. And National Healthcare Service, UK, is also our client, and I have conducted lots of training programs for them. Won lots of awards in various forums. And this is the one I was talking about, National Healthcare Service. We have done multiple Lean and Six Sigma related projects there, which is anyway part of the CPHQ syllabus also. And here is one person feeling so happy about doing the project. He's one of our students. And well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
Okay, just to tell you, as a CPHQ professional, you are able to save money for your hospital or for any organization wherever you are working. King Edward Hospital also have done lots of work. Anyway, I think I'm not CEO of King Edward VII Hospital in London, and we would like to. Anyway, I've got many videos appeared on TV shows. Those who are
Hi, I'm Shekhar Suman,
Z Business Show, etc., and spoken in American Society of Health. And,
on 20.
So in CPHQ conferences, etc. Deputy Health Minister of Saudi Arabia, Dr. Tarif Al-Amma, then and now Dr. Mohammed Abdul Ali. They have all attended training. Dr. Tarif. So I think this one's just was brief about myself, and now I think now I see that most of the people have joined. So welcome to those who have just joined in, and we have just started. Let us understand what is CPHQ. It's Certified Professional for Healthcare Quality. It's an examination conducted by NHQ. And approximately 17 to 18,000 or sometimes 19,000 people, a floating population of CPHQ professionals is there. Floating because you have to renew it every 2 years. So many people don't renew it. So sometimes you get certified And once you get certified, because you have a certificate, it is treated as if you are a CPHQ. So some people don't renew it, but those who renew at a given point of time, 18 to 20,000, approximately that number is present at the given moment. But since the beginning, more than 30 to 40,000 have been certified. It is going to, okay, let me first talk about, yeah. Okay, what I'll do is, sorry for skipping, no, I'll go back now. Yeah. So why should you earn CPHQ? You should earn CPHQ because it enhances your career. And lot of hospitals, they're looking for professionals who can analyze the data, not only analyze the data, they should be able to make sense out of data and give advice to the senior management. So that is one of the major roles CPHQ plays. Also, we share, when you join our training program, we give you all the material. We give you the material which is short and sweet. If you just study that material, you will definitely pass the examination. Our passing percentage is quite high. It runs into 90% plus. So 95%, 98%. In one of the batches I remember, I think it was in Cedar Hospital in Qatar. I conducted training program for 25 people, and all 25 of them, within 2 months, they got certified as CPHQ. So sometimes it is 100% as well. I conduct physical training programs also, but more often people prefer online training programs. And I conduct training programs on Saturdays. And that's a 6 to 7 hour session every Saturday. And around 4 to 5 Saturdays you get all the knowledge, all the information about how to write the examination and pass the examination. We give you all the material, all the books. We give you some extra reference books also. But in case you are not interested in reading too, if you're not interested in reading too much, then in that case, we can, uh, you know, just as I said, we give you a training material. Don't have to read too much. And but those who are interested, we will give you lots of material, but we'll tell you what to read and what not to read if you have got shortage of time. So material, enough uh, quantity of material is given to you. And so not to worry. Some people are asking about that question, so I'm just answering that question. Okay, so once you become a CPHQ, you can add CPHQ to your name, after your name. It has 140 questions. 125 of these questions are used in computing the score, and remaining are 15 pre-test questions. So 125 will be scored questions and 15 will be pre-test questions. So you don't know which are these 15 pre-test questions. They are all mixed with the regular questions. And that is why we say that when you are conducting or when you are attending or attempting an exam, don't spend too much time on any question, because you don't know which is a pre-test question and which is the scored questions. So if you spend more than 1.5 minutes on any question, probably you are wasting your time. And we have to enable you to answer the question within 1.5 minutes. And that's what we do. We have got lots of credentials. Lots of people have given lots of videos to us. Towards the end, if you want, we'll be happy to share these videos with you. But now let us start, understanding what is there in CPHQ, what is there in the syllabus of CPHQ. So there are 7 modules, quality leadership, integration. Give me 1 minute. I'll maybe show you this one. Yeah. So the 7 modules are quality, leadership, and integration. So let me first take you through the modules. Then subtopics also I'll take you through them. Then quality review and accountability. You have 16 questions from this. So 19 questions from quality, leadership, and integration. Then quality review and accountability, 16 questions. Patient safety, 18 questions. Regulatory and accreditation, 8 questions. Performance and process improvements, 27 questions. Healthcare data analytics, 26 questions. And population health and care transitions, 11 questions. So we have 7 modules. Now let us look at these modules very, very briefly. Then I will take some of the topics. If you have got any specific topics you would like me to speak about, today being an introduction, just an introduction to what is CPHQ, I can introduce you to few topics, whichever is your topic of preference. If you have got any preference about a particular topic, just let me know in the chat box. And depending on the responses, I'll choose the topics which people are more likely to get benefit. So just write in the chat box if you have any specific topic you would like me to cover today. In the quality leadership and integration, you learn strategic planning. As a CPHQ professional, you are an advisor to the senior management. You are a person who will advise to the leadership how to align quality with the strategic business objectives of the organization. So you will also advise the leadership on organizational improvement opportunities, assist with the development of action plans and projects, assist with establishing priorities. The second point, assist with development of action plans or projects. So in CPHQ, it is strongly advocated, or not only in CPHQ, in almost all quality initiatives, it is strongly recommended that when you want to improve something, when you want to improve a process, when you want to improve a measure in a process, you should use a project approach. So what is the difference between a process and a project? Process is something which is repetitive in nature. The steps are repeated again and again, delivering the same results almost. But in project, it is also a series of some activities, but it is done only once. You can say like it is executed. The project is executed only once in the history of universe. Never before something like that has happened, and never again it will happen. So what a CPHQ does is, when you want to improve anything in your organization, you convert that improvement opportunity into a project. And that is what project approach means. So as a CPHQ, you will be advising the organization to take up improvement projects. Then you will also assist them with establishing the priorities, participating in activities that support the quality governance infrastructure. You have to create a quality governance infrastructure, and what are the components of this infrastructure, you also learn. Align quality and safety activities with the strategic goals. Every organization wants to achieve a vision. Some vision is there based on their missions. Vision means how your hospital would like to be seen after, say, 5 years or 10 years. That's a vision, visualizing your organization after a period of time. And when you create a vision, then the senior management, they create strategies, ways how I can achieve the vision. I want to become a #1 pediatric hospital in the city, let us say. That is our vision. And by, let's say, 2030, we would like to achieve this vision. Then to achieve this vision, you have to plan. How would you do that? You have to create strategies. There are various ways you can achieve that goal, but you would like to strategize, you like to decide which is the good, which is based on my strengths and weaknesses and opportunities and threats. What are the best things I can do? And once you know that, once you are aware of that, then you create your strategies and integrate quality into that strategies. So how to do that? That's how you advise. That's what you advise to your senior management as a CPHQ professional. Then you have to also engage your stakeholders. Stakeholders are people or groups or organizations which are positively or negatively impacted by your improvement projects. So whenever you are trying to improve the quality, you would like to engage everyone. When you are doing an improvement project, you would like to engage everyone. So you need to identify the resource needs to improve the quality, assess the organization's culture of quality and safety, engage stakeholders to promote quality and safety, and provide consultative support. You are an internal consultant to the hospital, and also promote engagement and interprofessional teamwork. So that is about the quality leadership. Maybe I will cover one topic from leadership today to begin with. I keep looking at the question and answer Q&A as well. And if you have any questions, you can always write in chat box. Others will not be able to see what you are writing. Data analytics. So when I asked which topics you would like to cover, data analytics is what Reshma Ramchandra is telling. Dr. Mohammed is telling change management. Okay. And leadership. Okay. So I'll start with leadership, a little bit of leadership. And so I will just touch upon some of the subtopics of these topics which you have proposed. Okay. So if you joined a little early, there was a video which was running. I had shown my video of leadership, 5 levels of leadership. Now, if you have missed it out, just my team will put that video link in the chat box. Please do watch it. Okay. Then moving on, I'm just taking you through the very brief description of these topics. Then we'll select some of the subtopics. Quality review and accountability. 16 questions will be asked where you apply standards, best practices, and other information from quality-related organizations, and evaluate the compliance with internal and external requirements for clinical practice guidelines, pathways, and outcomes, quality-based payment programs. You will know about them, especially from US, but almost all countries have got similar programs. So it's always good to know about them. Documentation, practitioner performance evaluation, patient experience, identification of reportable events for accreditation and regulatory bodies. All these things are covered in quality review and accountability. While maintaining the confidentiality of performance and quality improvement records and reports, you have to achieve all these things. You will learn about that as well. In patient safety, 18 questions will be asked, and typically, if you're working in a hospital, you would know these are the basic things, and we don't see any person failing in this particular topic. So you will be learning about how to identify the technology solutions to enhance the patient safety, facilitate the ongoing evaluation of safety activities, and apply techniques to enhance the culture of safety within the organization. And you'll also learn tools like FMEA, failure modes and effects analysis. Probably I will not have time to touch upon the topic of FMEA, but I will definitely put up a link here in the chat box where I have given full information about FMEA and how to do an FMEA using a very simple example. And you can also apply this to your own processes. So if you are interested in learning FMEA, and not only learning, but also applying FMEA, you can always use this link, which my team is going to put. This link, which gives you all the information about FMEA along with an example, simple example, very day-to-day life example I have taken to explain FMEA. Once you learn about FMEA, you can immediately apply. Within one day, you can learn. One day means hardly 1 or 2 hours is good enough to learn FMEA, and you can practice it. And after that, you start applying to one of your processes. My team, if you can put the FMEA link here, that will be great. By the way, this link has been watched by more than 1.8 million people. So that was about patient safety. Then regulatory and accreditation, like how will you get your JCI accreditation, SIBAHI accreditation, or whatever accreditation is applicable to your hospital, depending on the country you are from. You can always get those that information, and that knowledge is imparted to you as part of your CPHQ syllabus. Then 27 questions from performance and process improvements, implementing quality improvement training. So a lot of people are telling about, I would like to learn about data analytics. I would like to learn about process and performance improvement. And these are the questions, like 27 questions from performance and process improvement and 26 questions from healthcare data analytics. So that is why we do emphasize on them. Then you'll be identifying the quality improvement opportunities, understanding the roles, responsibilities of the team members, participate in activities, and identify the innovative and evidence-based practices, lead and facilitate the change, use performance improvement methods like Lean, PDSA, Six Sigma, all will be taught to you, but not in detail. Really, it would be like enough information for a CPHQ to make some good improvements in their processes. But yeah, if you are interested in becoming a master in Lean and Six Sigma, we do conduct Lean and Six Sigma Green Belt, Black Belt, Master Black Belt, and they are really unique, one of our unique programs, and where you'll be getting access to all the tools and techniques, the video recordings, and also professionally made videos, which you can always keep with you. So those who are interested in knowing Yellow Belt, Green Belt, and Black Belt, Yellow Belt is a free program which we conduct, and you can always join it. And Green Belt and Black Belt, of course, is a paid program where you can always learn lots of tools and techniques which will help you to become a better quality professional. And the good news is that these tools and techniques, almost all of these tools and techniques are applicable to CPHQ. You learn fishbone diagram, etc., and you'll evaluate the team members as well. My team, if you are able to hear me, if you can just put FMEA link, if you are able to do, please let me know if you are able to do it or not. And otherwise, I will put it. Then you have got healthcare data analytics, where you learn about data management systems, how to assist in evaluating and developing data management systems, and to support the quality improvement. Ahmed Chishti is asking, what is the passing score and what are total marks? So what total marks are 125. 140 questions will be asked, but only 125 are the actual questions which will be scored, and 15 will be just pre-test question. The purpose of pre-test question is that these questions are given to the students just to check how the students are reacting to those questions. And if they find it very difficult, then obviously they will be classified accordingly. And if it is too easy, again, it will be classified accordingly. And then future question papers are based on these pre-test questions. So I hope I have answered your question. Yeah. So now here we have got lots of tools and techniques, as I was mentioning, designing the data collection plan, type of data, and then collect and validate the quantitative and qualitative data, identify external data sources for comparison and benchmarking, design scorecards and dashboards for various audiences. Okay. So we have got Rajimol is asking how many attempts for exams. You can keep on paying and attempting, but that's not the purpose. You have to pass at one go. So you get as many attempts you want, but yeah, the idea is not to take attempts after attempt to pass the examination. Why not have it in the first go? So that's how the idea is. Okay, data management system. Data management system, I think you're clear about that. You learn SIPOC, supplier input, process output, and customer, and lots of other tools and techniques, collecting and validating the quantitative and qualitative data, identifying external data sources for comparison and benchmarking. Benchmarking means learn from others. see how others are performing, design scorecards and dashboards for different audiences. All these are part of the data management system. Then you have got measurement and analysis. So you can use data management systems for organization, analysis, and reporting of the data. Use data visualization and display techniques. Lots of graphs and charts you will learn, and lots of hypothesis tests you will learn. Central tendency measures like mean, median, mode, standard deviation, etc., correlation, regression, etc. All these things will be taught to you. Use statistical process control techniques and tools. And when we are teaching all these things, the statistical tools, that is our main strength. The way we teach, you will be able to pass the examination very, very easily. In fact, we teach you much more than what the examiner is expecting you, accepting from you. And once you know much more than what is expected, obviously you excel. Then population health and care transitions has got 11 questions. And here you identify the data and resources that are important to determining the health status of the defined population. So here you are not only there to help your hospital save costs and improve the customer satisfaction, but you are also promoting the well-being of the whole population health and care transitions. So these topics are related to the impact a CPHQ can have on the society in general. So this will be the points which we'll be discussing. So let us start with the first one, leadership, because many of you have told that you would like to start with leadership. So these are the subtopics of leadership. Obviously, we'll not be covering all of them. Maybe one or two of them we will cover. Just have a look at it for the time being. Okay, great. I think you must have gone through this list. And now let us have a look at first topic. Now I'll just cover today leader out. See, one subtopic I'll be covering. And from leadership, let us cover systems thinking. What do you mean by systems thinking? See, leaders should have systems thinking. Okay. To understand systems thinking, let us draw a model of a hospital or a clinic or a lab or any organization for that matter. So here, if you look at this diagram, think of your organization, or you can think of your department also. Your department or your organization takes some inputs, and these inputs they get processed through a series of steps. Through a series of steps or departments. And they produce an output. Output is either a product or a service. There's no third type of output. So we have a product or a service. Say, for example, patient treatment process. So inputs could be the physicians, the nurses, the patient himself or herself, and the facilities, the equipment and medicines. So all these are inputs. And they get processed through a series of steps, A, B, C, D, E, etc. And they produce an output. Here, the output could be the health of the patient, improved health of the patient. That could be the output. These outputs are going to the customers. These outputs are going to the customers. And suppliers are supplying the. So suppliers are supplying the inputs, and then inputs are processed through a series of steps. They produce an output. So here, our output could be patient treatment or enhanced health of the patient, and whatever you are trying to achieve, generally that output will always have a measure. So whatever you are producing, either a product or a service, you will always be measuring, are you really providing value to the customers? The whole idea is to keep the customer happy, provide value to the customer. And we have to also remember the customers are not interested in the product or the service. Customers are interested in the value. And here the value is improved health, enhanced health. The value is not to give a tablet, very effective tablet. Obviously, you are achieving the value of enhanced health of the customer by taking care of these factors, which could be anything, like giving the proper medicine, following a treatment plan. But ultimately, you're creating a value for the customer. The value is improved health. So when you focus on improved health, then you will also sometimes, you will come to know that you need to change the processes. You need to change the process steps, because too much focus on the product or service which you are producing can deviate you from thinking about the customers. So that is why you have to think about the value. And also one more thing, which I should just put it here, is the strategy or the planning team. So you have customers giving the feedback, and you have also demand forecasting methods. So demand of your services, and also the feedback from the customers. They're strategized, they process, this information is processed, and then a strategy team creates new strategies. And also they will ask the supplier to supply certain raw materials. And along with that, if there is some feedback from the customers, so based on that, the planning team will inform the team members to make changes in the process parameters. So that's how the whole system works. And this is also known as systems map. And this thinking is known as systems thinking. Systems thinking. And a very popular name for this diagram is also value stream map. Value stream map. Okay, so I think you're clear about it. Out of this stems out one tool, which is also part of your CPHQ syllabus. SI, this is process. So P, O, and C, SIPOC. So when a quality professional wants to improve a process, first he creates a SIPOC of that process. So suppose you want to reduce medicine dispensing time. So you would create a process, a SIPOC of medicine dispensing process. Similarly, you can apply this to. Okay, can you think of your organization in terms of the system? Can you let me know? Can you think of your department? See, the systems map can be made for a department, even for an individual. As an individual, you have got so many customers, your family members, your boss. and the government, and sometimes your friends. And these are all your customers. And like suppliers, various suppliers, they keep issuing the inputs to you. And these inputs get processed and you produce multiple outputs. That's how we live our life. So that's why we say this is applicable everywhere, even to companies, department, a small department, large department, and even to yourself. Now, having understood this, let us leadership I was talking about, but because I don't know, my team is able to send the links or not. If you can just confirm, it appears, yeah, team. Can you please, I'm repeating, team, if you can just send the FMEA, or let me show, I think, should I share or you're going to share? Team is there or not? Just let me know. Yeah. Uh, let me share. Okay, not to worry. I will share. Okay. But this also 5 levels of leadership, that also I will share. So please watch these videos. It's a 5-7 minute video. I did play this video in the beginning before everyone joined. Some of you had joined in earlier, so that is why I just uh, some of you might have missed it out, so don't worry, I'll be sharing. So FME analysis, thanks. Someone has already shared from my team. Thanks for that. And let me also take you through some basic lean tools, which as part of a CPHQ syllabus, you are supposed to know. So a typical hospital environment, you have got high volume, high variety, high variability, high speed, and high stress. And this leads to some issues like service breakdown, wasteful processes, and medical errors. So let us talk about the wasteful processes in this short module. What is lean? Lean is about reducing the waste. It's war on waste. Okay. So to remember the 7 or 8 wastes, you can say I swim, TWO, I swim too, or also you can say Tim Woods, or you can say downtime. These are all acronyms, you can say, for your 8 wastes: waste of intelligence, a waste of rework, defects, scrap, errors, etc. Waiting time, any waiting time is a waste. Inventory, raw material inventory and work in process inventory, finished good inventory, all are wastes. Motion, unnecessary motion, which is not adding any value to customers. See, we have to think about the value from customer's perspective, not from your perspective. So if the customer is not willing to pay for a step, it is a non-value added activity or a waste. So let us take some examples like over processing or production. Let's take some example. So some are obvious wastes in our processes, but many are hidden wastes. And that's how you can find out. I'll not be going into the very details of each one of these wastes as of now, because it's an introductory program. So I don't think it's so much required, the introduction, to go into the details, but I'll just take you through some of the, I'll try to give you a high level view. Okay, let us look at the blood test process time. And here, if you look at this process, we also call this as Gemba investigation. Gemba means, in Japanese, Gemba means go to the place of action, go to the field. See how people are doing their jobs. And if you ask someone how his job is done, if you ask a manager, they will show you an SOP. But when you do a Gemba walk means go to the place of action, go to the battleground, see how the things are happening. And when you do that, you find that things are not happening either SOP, or even if the SOP is being followed, but the SOP is outdated, and there is a lot of waste in the system. Some of the waste which is very, very obvious. Now, if I ask you, walking to OPD department, is it a waste, or is it waste means non-value added activity, or is it a value added activity? Walk to OPD patient department. Register in OPD. These are all walking to the OPD, register in OPD, walk to the lab, wait for phlebotomist, draw blood, transfer blood to... See, out of these, only two, I can say only two of them, draw blood and blood test processing, they are value added, and remaining are non-value added. Now, someone may object to that. They'll say, well, you have to walk to the OPD, you have to register in OPD. That is the part of the process, but that is part of your process. But the customer is not willing to pay for it. What is the value customer wants from this whole process? Blood test processing time. What is the value they are looking at? The value is improved health. Now, if you tell me to register in the OPD, etc., walk here and there, it's not adding any value. So we say that 90% of your steps are non-value added activities, wastes. 90% of the time is spent on non-value added activities. An Asian hospital determined that 80% of nurse calls from inpatients were housekeeping in nature, and 25% of the calls were requests for room supplies like bed sheets and tissue paper. Means it's waste of intelligence of nurse. Nurse is not there to supply you bed sheets and tissue papers. But if you are asking nurse to do that because the patients do that, or your system allows you to do that, then the nurse will forget to give you the medicine, because of a waste of intelligence. Something which can be done by other person, and if that person whose capabilities could be better utilized is indulged in that activity, we call it as waste of intelligence. So there are many examples. I'll give some very brief examples. The application of lean techniques and Six Sigma techniques in one of the hospitals in US, we were able to double cardiology lab capacity from 8 to 16. We were able to reduce the diagnosis to exam time from 2,700 minutes to 64 minutes in one of the hospitals in US. And similarly, we cut admission from 17 minutes to just 5 minutes, and also reduced signatures or steps from 18 to 12. Approval time, any approval is a waste. Approval signatures is not adding any value. You may think that it is adding value, but why? What does the approver do? They apply some logic, some argument, and based on that, they either approve or reject. So why this can't be done by using a method? Why you have to have approver after approver after approver? Anyway, we teach about that and that concept in detail in our sessions. But I just wanted to tell you that if you apply Lean and Six Sigma or any of your CPHQ tools, plenty of them are given to you. You reduce the waste as much as possible and start generating the patient flow by processes. I think everyone is aware. I'll skip that part. Some more examples let me give you about waste, unnecessary processor motion. searching, turnaround, etc. Unnecessary waiting, unnecessary stocks of production, errors, unnecessary transportation, all of them are non-value added activities. That is the waste. Underutilized resources is a waste. Underutilized equipment is a waste. Okay, on a lighter note, cost of 5-minute MD walk is $6. Another note on, again, a little bit of pinch of humor there. Walk to elevator, 1 minute. Elevator wait is 3 minutes. Elevator travel is 1 minute. Walk to lab or pharmacy is 1 minute. The nurse cost per hour is $50. And cost of one trip is $5. Cost of 5 trips per day per nurse. And then cost of elevator wait per day. So you can think that lots of money. And you multiply this by maybe 300 days, multiplied by for 200 employees, if you have got 200 nurses. So it gives you some numbers which is close to million, so we never realized a lot of waste is there in our system. We also learn technique called line balancing. We also learn techniques like reducing the variation. So here, if you look at this admission rates, most of the peak is occurring here. But in absence of that, they figure out peak somewhere else. Yeah. So here, if you see, you are looking at admissions are happening between people, they want admissions early in the morning, but the beds are not available because the discharges are taking place in the afternoon. So this is an example of not balancing the line. So if you do this balancing act, you'll be able to allocate the beds sooner to your patients who are waiting. So try to make it, try to level it. That's what we learn as in the lean professionals. Yeah, as a CPHQ, you also learn about some of the techniques of error reduction. These are some visual controls. Visually, it is giving some message. And then you have intended surgical instrumentary. So there's a method called Pokayoke. Pokayoke means even by mistake. Pokayoke in Japanese also means foolproofing. Even a foolish person cannot commit a mistake. So this is an example of indented surgical instrument tray. So you will not be able to commit a mistake, even if you want to commit a mistake. Also, one of the lean concept is the visual hospital. The visual hospital means everything should be visual, and people should be not wasting the staff's time in asking some simple questions, which you can easily provide that information using the visual techniques. So this is an example of a visual hospital where you provide all the information so that they don't have to ask too many questions. The concept of mistake proofing, like in rice cooker, you have this the switch is put off automatically if a desired temperature is achieved. Similarly, you have robust process machines, smart machines, which cannot be set nor operated beyond normal, safe, or maximum levels. Similarly, smart heparin infusion pumps. Similarly, for robust process design, you have got normal range, abnormal range is automatically rejected. Then you have oxygen and nitrogen cylinders. They have different connectors. You cannot insert oxygen into nitrogen's pipe because the connections, they will not fit. Some more examples of Pokayoke, hospital Pokayoke examples, fixed number of packages during the surgery, complete catheter kits for insertion and prepackaged medication cart with correct dosage. Now let us talk a little bit about the data also. And I'll show you some data analysis. Although the purpose of this training program is to give you some direction to show how the things actually work. And when you join my regular sessions, we'll practice using lots of question and answers. We'll practice how to analyze the data. But before that, do you agree that there are two types of data? Some can be measured and some cannot be measured. Do you agree that? Do you agree with that? Okay, so let me tell you, there are three rules. You can't improve if you cannot measure. That is first rule. Second rule is you can measure everything. How we can tell you that? So you can't improve if you cannot measure. Second rule is you can measure everything. Third rule is that if you think something cannot be measured, probably it is attribute data or qualitative data. So let me explain that part to you. The continuous data are also known as variable data. It is continuous and quantitative in nature. It can contain a decimal point. See, it is also known as continuous data because any point on a continuous line, any point on a continuous number line is possible in continuous data. If I take you back to your school days, your mathematics teacher probably used to say, this is a number line between minus infinity to plus infinity. Any point like 55.5, 55.5 is continuous data. It is obtained or it is seen on we can find the continuous data on a continuous line. We can have 55.5, 6, 2, 8 also. And it always has a unit. When you are taking or collecting continuous data, 30 to 50 samples are good enough for you. Then we have attribute data or qualitative data. Here we don't have any continuous data, but you categorize the data like gender. Gender is an attribute data. Male, female, they are subcategories. So gender is attribute data and the categories are male, female. So attribute data will always have categories. Remember that. Thumb rule here is 200 to 1100 is a good sample size. And from where these numbers are coming in our regular sessions, we explain that it's pretty easy, nothing so difficult. Okay. Okay, what I will do is I'll show you some, because you had asked me that you would like to see some data analysis. Let me show you that. So I hope you are understanding whatever I'm covering till now. You are with me. Let us think about data analytics, a little bit of statistics as well. And just let me know if you're comfortable with that, because yeah, in such a short time, not everything is possible. I may be a little fast while explaining the concept, but in case you want me to slow down anytime, feel free to write in the chat box and I'll be happy to slow down. So let us talk about the data, two types of data. As I was mentioning, there are two types of data: continuous data and attribute data. And the best way to learn is, I think, here on the whiteboard. So there are two types of data, as I said: continuous and attribute. And we already saw continuous data like age, 24.8 years. Can you give me some more examples of continuous data? Waiting time, yeah. 2.5 hours. Yeah. Some more examples. Days, yes, Akram is giving example of days, yeah. So I hope you got it, right? You have a unit there. These are units, and there's a possibility of a decimal point. That is why it is continuous data. Now, in attribute data, we feel then there is an attribute which we cannot measure. So whatever is the attribute, whatever you want to measure, you write that name. So what is the attribute? What are the possible categories? And after the categories, you have count. And then after the count, you also have proportions. Okay, let me use a video. I think it will save my time also. This is a short video detailing what are the types of data. Okay, so yeah.
5 years, that's my age. Height, maybe 180.1 centimeters. Cycle time of a process, 3.5 hours. Or procurement time in an organization, 120.3 days. These are all continuous data because they all have a possibility of a decimal, means they can be expressed in decimal points, and also they all have a unit. Now let us talk about attribute data. Attribute data can be expressed in categories, and categories can be counted. Say, for example, if you want to measure happiness, so easiest way to measure any attribute data is to create a category, and if possible, you can create a binary category. A presence or absence of that attribute can be one of the simplest categories. So if I take the example of happiness, two categories I can create: happy, unhappy. So if I want to increase the happiness in the employees in the organization, then I can always count how many employees are happy. Let's say 60 employees are happy and 40 employees are unhappy. I can express this as proportion. That means proportion of happy employees in my organization is 0.6 and proportion of unhappy employees is 0.4. And it can also be expressed as percentage. Now, this proportion or percentage, they don't have a unit. And a count like 60 employees, I can't have 60.1 employees who are happy. So the count will not have any decimal point.
Okay, so I hope you understood this, that we have a category. So whenever we want to measure any attribute, we categorize that attribute. That's what we did. Happiness, we converted to happy, unhappy. And now 60 or 0.6 or 60% of the employees are unhappy, or sorry, happy here. Yeah. So you you get a fair idea about the happiness index in your employees, and you would take up an improvement project and say that after 3 to 4 months, after working on the root causes, the 60% will increase to 80%. And count it by itself doesn't make any sense unless you know the proportion. So that is also important to note, that you should be knowing the proportion to make sense out of the attribute data. I'll take an example, like say, for example, before I go to another example, let me also tell you, proportion means portion out of 1. So if the circle is 1, so 0.6 belongs to happy category and 0.4 belongs to unhappy category. And then if you want, so proportion means portion out of 1. And if you want percentage is portion out of 100. Yes, so great. I think, have you understood this part? Now, once you have understood this, then your lot of data analysis will be easier. Let us see that. And around 10 to 15 questions are based on the data analysis. And let me show you some of the things which easily you can answer. Okay. Like here, we were taking an example. I can write here patient satisfaction. Yes. Patient satisfaction. And patient satisfaction, you can classify into satisfied, dissatisfied, or you can have a 5 scale. For the time being, in the interest of time, I'll just create satisfied or dissatisfied. Okay. And I checked with 100 patients. 70 are satisfied, 30 are not. So this becomes 0.7 and 0.3. Now, if I want, suppose I want to find a correlation. Okay, let's go step by step. If I want to just express how, what is the average age of people or the patients coming to our hospital, or what is the average waiting time? If you're trying to just express, that's it. You will use histogram. Histogram means average age of patients. visiting the hospital is 35. Sometimes they go to 40. As you move above and above, you have less and less frequency of that width. So 35 to 40 people are, let's say, out of 100 samples, I got 30, 40 people in that. But as you move away from the center, the number of people coming into the category starts reducing. We call this as normal distribution. Normal distribution means, if you want to take a very simple example, your traveling time to office every day. Traveling time to office every day. So you can say that most of the time you take 30 minutes, but sometimes 35 minutes, 40 minutes, 45 minutes. Almost never you go beyond 50 minutes or even 45 minutes. Similarly, for 25, 20, and 50. Oh, here it's 30. So this is 30. So 25, 20, and 15. So very few times you will take less than 15 minutes. Almost never you will go below 15 minutes. And almost never you will go above 45 minutes when you're traveling to your office every day. Now, most of the repetitive processes, they follow this normal distribution. Whatever repetitive process. Repetitive process means that you keep on repeating that process again and again. And Mr. Gauss, he found a very interesting phenomena about this process. And he found that if you collect the data, any continuous data, around 30 samples, that's the magic of it, 30 samples. Just collect 30 samples, get your average and get your standard deviation. Now, in our session today, it's an introductory session. I'm not going to go into deeper down into how to calculate the standard deviation. Nowadays, softwares are there, you can calculate. But I also explain in my session from where you're getting that formula. But for the time being, just trust me that you can easily calculate the standard deviation in just one go using Excel sheet or even Minitab. There are lots of softwares available, free softwares available. And we train you in that as well. Excel sheet, some basic analysis, so that you can answer the questions very easily in the examination. Let us say your average is 30 minutes and standard deviation is 5 minutes. So Gauss, one gentleman called Gauss, he found one interesting phenomena. He found that if I just collect 30, 40 samples, not more, I'll get an average and I can get a standard deviation. This is X bar. So plus 1 times standard deviation, plus 2 times standard deviation, plus 3 times standard deviation here, minus 1, minus 2, and minus 3. So within plus minus 3 times the standard deviation, will lie 99% of your whole process. Within plus and minus 3 times the standard deviation. Now, standard deviation can vary from process to process. You have to actually collect the data and get the standard deviation, which is pretty easy. But once you know the average and standard deviation, you can make predictions. Say, for example, here I can make prediction. Okay. Average is 30. 1 time standard deviation. How much is standard deviation? 5. So 35, 40, and 45. Here it is 25. I hope you are understanding. Please let me know in case you are not getting from where these values are coming. 25, 20, 15. Minus 5, minus 5, minus 5. So I can say that I'm traveling. Let's say if this is my data, let's say. So if I'm traveling, I will always travel between 15 to 45 minutes. I'll never go below 15. I'll never go above 45. We call this as control limits. We call this as lower control limit and upper control limit. And you can also make a chart, control chart we call. So a little bit of variation is always there in control chart. This is again 99% of the time you'll be getting the values within this range. So there is natural variation. You can't assign a specific reason for that. It's a natural variation. Okay. So you are with me up to here. Any questions you have? Now I'm explaining you the concept of control chart. So control chart is nothing but the lower and upper control limits expressed. Lower control limit, how much it is in the case of example, my traveling time. Lower control limit is 15 minutes and upper control limit is 45 minutes. And this is an example. I'm just making some assumptions here. So average time is 30 minutes. Standard deviation is 5 minutes. I can get the control plus and minus 3 times the 5. Plus and minus 3 times the standard deviation. Standard deviation is 5 minutes here. So I'm assuming that you have understood. Some of you are responding saying that you have understood. If you have not understood, please let me know. Please, I'll be happy to explain. By the way, this video is available to you any number of times. You can always watch this video. Okay, great. Now there would be 2-3 questions on control charts. Yeah. So if I go back. So here, if someone asks me why yesterday I took, let's say 25 minutes and today I'm taking 30 minutes. Why? What is the reason? So in this case, okay, let me take help from, again, one of the videos.
A final note before I close the data collection topic is that, so I collect the data of my travel time from my home to office every day. And I find that on an average, I'm taking 30 minutes and standard deviation is 5 minutes. And we know how to calculate the standard deviation and how to calculate the average. Now, if I plot the data on a histogram, then lower control limit would be minus 3 sigma limits, that will be 15 minutes, and upper control limit would be 45 minutes, that is plus 3 times the standard deviation. So lower control limit being 15 and upper control limit being 45, I can say that my travel time is going to vary between 15 to 45 minutes. So you can expect me to travel to my office every day between 15 to 45 minutes. If someone asks me why this variation between 15 to 45 minutes is there, I can tell him that it is due to common cause variation. What is common cause variation? I can say that the variation between 15 to 45 minutes is due to lots of factors. These factors can be the traffic on the road, the weather, the car I use, my mood, or it can also depend on at what time I start from my home. So a lot of factors, which we can call it as X factors, are affecting the travel time, which is the Y here. So I can make the statement that the variation between 15 minutes to 45 minutes is due to the common causes. Means all the causes are acting on my system and producing this variation. This is known as voice of process, as if my process is telling, my traveling process is telling that I will take between 15 minutes to 45 minutes. Now, if I take 60 minutes to travel to my office, then same question is asked to me, that why did I take 60 minutes? Then my answer won't be that all the causes are acting on my system and producing this variation of 60 minutes. I might be able to point out a cause. We call it a special cause. So I may say that I took 60 minutes because maybe today there was too much traffic on the road, or it can be any factor. So when I go out of control limits, I can specify a special cause. And we call this variation as a special cause variation. So we have 2 types of variation, common cause variation and special cause variation. Common cause variation is part of the process, part of the natural variation of the process. And special cause variation is assignable variation. I can assign a cause to that particular event. Now, what is the difference between common causes and special causes? For special causes, you need to take immediate action. Means you need to take a prompt action so that you are able to bring the process within control. But for common causes, you should not take any specific action. Usually, the common cause is within the control limits, and if you want to act upon the common causes, you might have to change the control limits, and changing the control limits takes effort. You may have to do a DMAC project. You may have to do a lean project. You may have to do a Six Sigma project. And that's what we are doing. That is why we say that lean and Six Sigma is applied.
So I hope you understood and got the point here, what I'm trying to say. What is common cause and what is special cause? Common cause is something which is commonly present in the process. See, and then we call that process is under control. Process under control means it is within the specified, like within the usual behavior of 15 to 45 minutes. Now, that doesn't mean I'm happy with my process. Let us say 15 to 45 minutes is the waiting time of my patients. On an average, patients wait for 30 minutes. Standard deviation is 5 minutes. And based on this control chart, same control chart, I can say that 99% of my patients are going to wait within 15 to 45 minutes. 99% is going to take between 15 to 45 minutes. The patients, they are going to wait for that. 45 minutes above, oh, usually no. 15 minutes or below, usually no. But you'll find that if you don't monitor that process, the control limits will start shifting. They will increase. They'll, instead of 15 to 45 minutes, they may become 40, let's say 20 to 50 minutes. Slowly and slowly, drift happens. So once the process is under control means it's ready for improvement. Process out of control means too much of haphazard variation, ups and downs. The process is not stable, we say. Process is not under control. It has got special causes, and special causes, you have to act on it. But for common causes, doesn't mean that you cannot do anything. Just doesn't mean that.
Effort. You may have to do a DMAC project. You may have to do a
Oh, sorry. Okay, I don't know how long. How long was I was on mute? Sorry for that. Yeah. So was it just okay? I'll just I'll just I'll explain this part again. So see what I'm trying to say here is that this is the process, and this is the process under control between 15 to 45 minutes. Process is under control. It is not showing any special cause variation. It is not out of control, but doesn't mean that I'm happy with the process. 15 to 45 minutes are my patients. They're waiting. Today, my patients are waiting 15 to 45 minutes. You would like to change the limits. You like to perform between 0 to 20 minutes. And that's a very, very good process. Means much improved process from what you are today. 15 to 45 minutes is what you are. You are at 15 to 45 minutes, and you would like to move to 0 to 20 minutes. So what you are doing, you are changing the process, changing the limits, control limits of the process. So when you are changing the control limits of the process, you are improving. We say this is known as improvement. And CPHQ professionals are capable of affecting those improvements. They can bring in those improvements using those tools and techniques. So some of the tools and techniques I'll also continue to tell you about these tools and techniques. But till now, any questions you have understood? Now, there will be questions, they'll be asking questions in CPHQ professionals. Is this process under control? Is this process out of control? Now, there are certain rules which we learn in our regular training programs. So you get well prepared for your exam. Once you understand the essence, what do you mean by process under control? What do you mean by process out of control? What do you mean by improvement? Then it really helps. Okay, one more thing. I just spoke about the continuous data. What about attribute data? Now, attribute data, you usually don't express in histogram. You express in pie chart or bar chart. Say, for example, this is a pie chart about patient satisfaction, 0.7 and 0.3. So this is, or 70 happy and 30 unhappy. This is known as a bar chart. This is known as pie chart. Okay. Because it's categorical in nature, so there is no histogram. Now, what happens if I want to, let us say, I want to study, is age and waiting time correlated? Age of the patient and waiting time, is it correlated? Means I'm trying to establish, now I'm doing some root cause analysis, and are they correlated? Means what I'm trying to establish here is, if I'm trying to reduce the waiting time, and if I find waiting time could be related to lots of factors. It could be anything, like waiting time could be availability of the doctor, waiting time could be related to time taken to do the billing. So many things. So whenever I am trying to establish correlation between the two factors, both of them are continuous. Then we use, so I'll just write continuous plus continuous. Both are continuous data. And I'm trying to establish a relationship between the two. Like say, for example, patient waiting time. Is it responsible for time taken to fill the registration form? If I find that something like this exists, we say there is a relationship between the two. Waiting time and registration time. More is the registration time, more is the waiting time. Maybe, maybe not. Or it could be something like this. There is no relation. Or it could be something like this. There is a relationship, but it is negative relations. So this is known as positive relation. This is known as no relation. This is known as negative relation. So when you are dealing with continuous and continuous data, you will always make scatter plot. This is known as scatter plot. And if you want to correlate between the two factors, like is waiting time and patient satisfaction. Are they correlated? Are they correlated? If I make the patient wait for a long time, does it impact my patient, the satisfaction score? What you do here is, one is continuous, one is attribute. So waiting time. Another example, and I'll come to this example also. So I'll say happy patient, and this is unhappy patient. Just for the sake of understanding, simple example. When the waiting time was high, I found patients very, very happy. Sorry, reverse is true. So here, when the waiting time was high, patients were unhappy. And the waiting times were low, patients were happy. This we call it as box plot. We call it as box plot. So when to make a box plot? When one of the factor is attribute in nature, and one is continuous. Attribute and continuous. If that's a combination, then we use box plot. So you have understood when to use box plot. Suppose it may also happen, instead of waiting time and satisfaction, it may happen something like this. Just means that waiting time and customer satisfaction are not correlated. You wait for more time or less time, still have people happy. And we have people, like you wait for less time or more time, still we have people happy. So we say that there's no relation. So I'll just show you, you will also get to know what type of Minitab analysis or any analysis, data analysis. Now you'll not be asked any question on Minitab or the software, on Excel, etc. As long as your concepts are clear, you should be able to pass the examination. So that's the whole idea. Concepts should be clear. And we clarify your concepts in the class. So this is the patient discharge time in a hospital. And because the data is continuous data, you look at the data, continuous data. So we have used histogram. So this is how our discharge time behaves. You have got your mean 300 minutes. Standard deviation is 25 minutes. And you would like to know how the maybe control chart looks like. Now, you can see the control charts. 303 average. Upper control limit is 379 minutes and lower control limit is 227 minutes. So based on the chart, you can answer some of the questions like patients in this hospital are being discharged between 227 minutes to 379 minutes. And obviously, they would like to improve. So how would you improve? So there are a lot of tools and techniques. Let me show you that as well. Um, Before that, I would like to also, so um, there is one tool called Ishikawa diagram or cause and effect diagram. I won't go into the details as of now, but you try to brainstorm on 6 M's: man, machine, material, method, measurement, and environment. Environment, also known as Mother Nature. So that's how the word environment came. So you can quickly make a cause and effect diagram or fishbone diagram, they say. So what is causing the problem? Why this? Why do we have this particular? What are the possible causes of this? So discharge time delays due to lots of things: staff not available, skills, motivation, old equipment, no equipment, etc. Okay, which of them is occurring most? Which of the cause is occurring again and again? So reasons for delays there: reporting not accurate, discharge summary delay, etc. And then you find that some of them are occurring more often than others. Reporting not accurate, discharge summary delay, staff not available, pharmacy delay. There are so many of them. But using voting technique or using the real data, go and check the real data. How many times reporting not accurate is occurring in our hospital? Oh, 27 times. Then you make a Pareto. Vilfredo Pareto was an Italian economist who found that 80% of the money in Italy was with 25, I think 80% of the money was with 20% of the people. He called it 80-20 rule. 80% of the money is with 20% of the people, and the remaining 80% of the money is with, like, or remaining 20% of the money, whatever remains, is for the 80% of people. 80-20 rule. So 80% of the diseases for which patients are coming to you, they comprise of only 20% of the total diseases your hospital is working. So your hospital may be working on, let's say, 20 or treating 20 diseases. And 20% of 20 is 4. So you will find that 80% of your customers are coming for these 4 treatments. That's called as 80-20 rule. So here, I can easily make control chart. Sorry, not control chart, your Pareto chart. And it says that the reporting not accurate is occurring most of the time. Staff not available is appearing a little lesser time. Pharmacy delays appearing further less. And discharge summary delays further less. And as you go away, there are very, very few causes. We're not saying they don't occur at all, but they are fewer and fewer. And the percentage contribution is also listed here. And if you look at the cumulative percentage, cumulative is 29 plus 25 is 54. 54 plus 12, 65. 60. So if you just take care of the first 4, if you look at the cumulative percentage, means this first 2 together, first 3 together, first 4 together, you'll find that 75% of your problems will be solved if you address these 4 causes. And that's how you will progress. Then you can further validate those causes using the rules which I just gave it to you. I spoke about some of the rules here. let us see, let us investigate. Some of the factors in our Pareto chart were discharge summary delay, pharmacy time, staff availability, and reporting accuracy. Now let us examine, is discharge time, which is our output factor, which is what we are trying to reduce, patient discharge time, right? Is it impacted by the discharge summary delay? Both of them are continuous data. And if you remember, both of them are continuous data. We use, both of them are continuous data. We use scatter plot. So let us do scatter plot. Now, in CPHQ, they'll never ask you to use software, by the way. I'm trying to explain, giving a real life example. Only the charts will be given to you. In the example, only charts. In the exam, you'll be getting charts. So here, discharge summary delay, discharge summary. So here I'm trying to see, it appears that patient discharge summary delay, as it increases, the discharge time increases. So we should do something about it. We should improve. We should find out means and ways to reduce the discharge summary delay, because it will impact our discharge time. Discharge. Okay. Any questions? Okay, let us see the other aspect. Discharge time and pharmacy time, time taken for dispensing medicine, etc. Are they correlated? Most of you will say yes, they are. Let us see. Pharmacy time. Oh, it is not related. You have, 20 minutes also, it takes long time. If it is more also, it takes less time, and so on and so forth. So there is no relationship between pharmacy time, and that is not the root cause. So this is how we do the root cause analysis. I just showed it to you. I think you got a good idea. Now let me tell you some of the ways, some of the methods of improvement. So I gave you one, this is the data analysis part. I just showed it to you. And using data analysis, you can make some conclusions. And in the exam questions, they will ask you details about cause and effect diagram, Pareto chart, scatter plots, box plots. When you join the session, I'll be happy to give you all the details and prepare you well for the examination. Well, some of you are asking how to join. Okay. Okay. How to join. So my team will be happy to tell you about method of joining the training. So if you can just, and I will continue after this, maybe I'll talk more about some of the other tools and techniques when we are talking about process improvement, but our team will be happy to. Yeah, thanks. Our team has also given you videos on fishbone diagram, Pareto analysis, and many of you said that you would like to learn about data analysis more today. A little bit of another improvement, let me, but I think let us first know the dates of our CPHQ session. So if you are interested, we have been doing the CPHQ session for 10, 15 years, as I was telling. And personally, I am also almost same years I've spent in the CPHQ conducting the CPHQ trainings. Earlier, they used to be physical in the physical classroom. Now it is taking place in online. Yeah. My team would like to show the dates. If you would like to show the dates, let me know.
Sir, give us 5 minutes time.
Okay, no problems, no problems. So what we'll do, we will, I'll continue. So let me show you. So if you remember, just to summarize, when the data are continuous and continuous, you use the scatter plots. And when the data is attribute and continuous, you use box plot. So let me use the box plot. Let me show you. Discharge time versus reporting accuracy. If the reports are not accurate, the discharge time, does it increase? Now, everyone will say yes, of course. But CPHQ professional, he believes like Deming's principle, in God we trust, rest others bring data. So we are not going to trust you unless you show me the data. So I'm getting impacted by the reporting accuracy. Well, I will do a box plot. So we have box plot. So discharge time versus reporting accuracy. Discharge time versus reporting accuracy. So the reports are correct. If they are correct, you take less time. And if they're not correct, you take more time. That means I need to work on report accuracy in my company. Now, this is not true for every hospital. When you are collecting the data from your hospital, you are making conclusion about your hospital. You cannot generalize it. So here your conclusion would be reporting accuracy actually impacts the discharge time. And we need to ensure the reports are accurate. Okay, great. So, yeah, one more thing, discharge time versus staff availability. Is staff availability impacting my discharge time? Let us see. Now, this time I'm putting again staff availability. Staff is available or not available, it hardly matters. They're available or they are almost same. So don't worry about the staff availability. Staff availability is not the root cause in your hospital. And that's what a green belt here CPHQ would say. Okay. Great. Any questions you have? So I did cover quite a bit of leadership, little. So I covered parts and bits and pieces of almost all the topics you suggested. Leadership you suggested. Change management is one thing. Let me talk about that also. Not to worry. Change management. But once my team has got, do you have the dates, please? Okay, so just let us see the dates. Let's see the dates of the forthcoming examinations. Forthcoming sessions. So the next weekend batch is starting on August 30th, 6th, 13th, 20th. Or if you miss out on that, you can attend 27th of September, etc. One good point about our training sessions is that if you join one session, you can join any of our future sessions any number of times, totally free of cost. So if you sometimes not able to appear for exam in the next 3 to 4 months, you can again revise by attending our sessions. What else? Any other information you would like? Okay, timing. These are the timings for Saturdays. You can. Oh, yeah. So what I'm saying is um, there will be a discounted fee if you register today. We offer it AED or Saudi Riyal 1200. So usual pricing is $1,500, or not dollars but dirhams, and we are giving an offer if you're registering today, tomorrow for this within 2 to 3 days, then you will be getting it at a discounted price. So we would like to invite you to this. Lots and lots of good credentials we have. We do have information and lots of good examples and proof of excellent training resulting in certification. We have got the Cedar Hospital people talking about our CPHQ certification. Do we have that video? Okay, so in case you have got that video where Cedar Hospital, you can play that. Okay, great. Any other questions you have? So there are other modules also in CPHQ, but we cover each and every module in great detail. And our focus is to make you understand the topic so that don't have to spend too many mock exams. You keep doing mock exams and you keep postponing the exam. You just keep right. Yeah, this one. If you can just this one, you can.
Hi, so I've just completed 3 days training of the CPHQ, which has been absolutely fantastic. Amitabh from Anexa has been phenomenal. The course materials have been fantastic. I think what I really enjoyed about this was that I could relate a lot of this methodology to healthcare, and a lot of the examples were things that I could contextualize it with healthcare. So I'm from here in Qatar at Sidra Medicine, and so again, thank you to Amitabh for this fantastic training.
And there are many people talking about CPHQ, our CPHQ sessions and the great impact they had. Many people, they attend our training program just to learn the skills. They are not interested in passing the CPHQ, but they still come to the session just to learn those skills or the techniques or tools which you just saw.
Hello everyone, future CPHQ professionals. I just want to give you a bit of an idea of our last 3-day course on the CPHQ exam preparation. It was awesome. We covered the majority of the topics in a very targeted and focused way that allows us to later on focus our studying and our energy and our time on what really is of value for the examination, but more importantly as well, because of the practical examples that Amitabh was able to provide us in our everyday healthcare work. One thing that I really benefited from the course is that Amitabh from Anexas was able to provide us with answers and solutions, especially at the statistical level, to questions and problems beyond the CPHQ course, to exercises and projects that we do in our everyday work life. For that, I would definitely recommend the course, taking it with Amitabh and Anexas. It's been a great experience, both for my preparations for CPHQ, but more importantly for my everyday work. Thank you so much.
Okay, so there were some credentials, and I hope you got convinced. And in case you are interested in writing the CPHQ examination, or interested in knowing the quality rules and techniques to improve the processes in your hospital, most welcome to join my CPHQ. Even if you want to join my yellow belt is free. Green belt and black belt training programs as well. Feel free to connect with me. And feel free to connect with our team. Also, you will be getting a certificate once you complete the regular program. Only training we'll give you a certificate saying that you have attended a CPHQ preparation course, and you also get a certificate, CHQE, Certified Healthcare Quality Expert. You will be getting that after finishing the course. Any other question we have? What about laboratory tests? It's okay. The ambulance service was giving. Okay, you were answering my questions those days. Great. Okay, great. So I think let me wind up the session for the day. Thanks for attending, first of all. And I hope you got some information from this. And more importantly, when you join our sessions, it will be a lifelong association with me, because my students 20-year-old ago also, I used to conduct training programs, and still I keep meeting my people, and we are always together, and they always remember the sessions we had in the beginning. So with that, I strongly would recommend that you go ahead with this program of CPHQ certification. It will enhance your career a lot. Thanks a lot. Thank you.
Do not make these mistakes if you want to become a CPHQ professional or pass the CPHQ exam. The theory in CPHQ is totally different than practical implementation. Make sure you are being trained by those who give practical knowledge rather than just giving simple textbook training. It is not an easy test to pass. Determination and hard work is required, along with the right guidance that is provided, of course, by us at Anexas. Each question is designed to test if the candidate possesses the knowledge necessary to perform the task or has the ability to apply the knowledge to a job situation. So prepare accordingly. Learning the statistical tools is very, very important part while preparing for your CPHQ exam. Many people mostly fail in data analytics and performance improvement topics. And of course, Anexas is expert in that. Many professionals postpone the exam by giving some excuse. If you want to be a certified CPHQ professional, plan it, work hard for it, and give the exam. Excuses will not take you anywhere. Hard work will. Walk the journey with us as Anexas, and you will enjoy the CPHQ preparation. Undergoing a CPHQ training is like keeping pace with the quality standards and advancements in the healthcare sector. The CPHQ certification is a credential that signifies both professional and academic achievement for those who are in healthcare. Certified professionals in healthcare quality, that is CPHQ, can be taken up by anyone who is in healthcare profession or wants to pursue a career in healthcare. Once you are a CPHQ certified, it will signify that you have the specific healthcare quality skill set and knowledge that can make a difference in improving outcomes across the healthcare sector. There is no eligibility requirement to sit in the CPHQ exam. The CPHQ exam consists of 125 multiple choice questions which are scored and 15 multiple choice questions that are not scored. You are allotted 3 hours to take the CPHQ exam. The score needed to pass the CPHQ exam varies each year based on the difficulty of the exam. On an average, you need to answer approximately 70 to 75% correct to pass the exam. We at Anexas have trained more than 3,000 CPHQ professionals, and we can also help you to write your exam successfully. Here are some few tips from us for exam preparation. First one, regarding time management. You don't have to study thick textbooks and 5 different test preparation materials to pass the exam. We provide you with all the material required. Using Pareto's 80-20 principle, we have segregated 20% of the most important material and we tell you to study that. Just read it and solve some mock exams, which of course we are going to provide you, and you are ready to appear for the exam. After attending our course, if you want to revise again, you can join our course once more without paying any online training fee. All the best for your exam. Hi, I am Anexas Master Black Belt Amitabh Saxena, and let me talk about importance of Lean and Six Sigma in healthcare. Lean Six Sigma concepts are used in industries all over the world to improve a process, eliminate waste, and reduce defects. In the healthcare industry, defects not only affect revenue and customer satisfaction, but they signify the difference between life and death. Lean Six Sigma is critically important in healthcare because it helps in reducing defects that can result in medical errors. There are so many challenges in the healthcare industry, like an aging population, shortage of workers, increasing litigation, and many more that require long-term improvement. Because healthcare industry deals with saving lives, errors cannot be accepted at any cost. So, how does Lean Six Sigma really help? With the help of Lean Six Sigma, you can shorten the waiting times in hospitals. The lesser the people wait, the efficient the hospitals will become. Reduce medication errors and even try to completely eliminate them. Improve turnaround time for lab results. Provide better care at lower costs, ensure that the medical staff makes fewer errors, reduce mortality rates, improve patient care, improve quality, and improve overall patient experience. How can you do that? By training the staff as green belts and black belts and allowing them to do improvement projects. Lean Six Sigma training and certification in healthcare provides the tools needed to address the challenges at various levels. It is a time for the healthcare industry to utilize Lean Six Sigma methods to its fullest and drastically change the healthcare industry for the better. Don't you want to be a part of the industry where patients are happier, physicians want to work for you, the cost is as low as possible, and at the same time efficiency is high?
If your answer is yes, then Lean Six Sigma is your choice. We have implemented Lean Six Sigma in more than 25 hospitals worldwide, including ministries of health of 4 countries, and we can help you too.